What's up, guys? So I got a question here from Medicine Man, I believe is his handle, and he wants me to talk specifically about tips for new grads and some time management tips. Okay, so I've thought up about the top 4 do's and 4 don'ts for new grads. Okay, just to develop into a quality respiratory therapist and a successful respiratory therapist inside your department. Okay, so what's odd about this is that you can be a really good respiratory therapist, but if you can't get along with the people in your department, you're going to be highly unsuccessful in that place. Doesn't matter how good you are. Okay, so it's not as simple as just tips for new grads on becoming a good respiratory therapist. You also have to have a desire to want to be successful in the place at which you're working. Okay, so that's kind of how I'm going to go with this. Okay, so the first don't is don't act like you know it all. Okay, I'm telling you, anybody who's been out of the field for more than a few years, we see right through it. And even if you do know it all, even if you are superiorly smart, like super sharp, like you come out on a level up here, well beyond some people maybe have been practicing 2-3 years. Okay, don't act like it. Okay, just don't do it, because no matter what you think and no matter what you're sure of in your own knowledge base and your own skill set, you are still the new person on the block. Period. It's just that. Okay, and you're gonna find where you're gonna get this bad rap for being the know-it-all. Now, who do you think you are? You just graduated 2 months ago and you come in here and now you carry yourself like my 20 years of experience is trumped by your 2 months of experience. Okay, it doesn't settle well with the people that have already established themselves as working respiratory therapists. So don't act like you know it all. On the flip side, do continue learning. No matter how good you are, you have got to continue learning. Now, how do you continue learning? Well, you do a lot of observation. You want to go out with this mindset of becoming a transformer of all of the respiratory therapists that you're working with, because your way is probably good. Okay, and maybe it's not, I don't know, but if you think that you're the bomb, okay, and you might have that mindset of like, man, I got this, man, this is a piece of cake, right? I was top in my class, top clinical person in my class, I got this. I promise you, you can learn something from other respiratory therapists that have been doing this for much longer than any new grad. Okay, so what you want to do is you want to observe at every chance you get. You want to ask questions. If you're not sure about something, ask. Okay, and ask in a non-cocky way. Just say, hey, I want to pick your brain for a minute. Remember, I've told you this before. If you ever use that frame, let me pick your brain, all of a sudden people go, why, yes, absolutely. What would you like to know? All of a sudden they realize that you have humbled yourself to learn from me. Okay? So use that phrase, hey, let me pick your brain. I got this patient up on the floor. This is what I'm seeing. This is what I'm thinking. What would you do? And watch the reaction you get. Now, what you did in that situation is you, one, either learned a different way to fix a problem, or two, you get validation that what you were thinking is correct. And without being cocky, you just showed off your skill set and knowledge base without having to show it off. Okay? That's the best way to show people you know what you're doing and to gain the confidence of the people around you, is to what am I thinking versus what would you do? And then see. If you don't agree with what they would do, then ask somebody else. Okay? If you don't know what a word means, you have a smartphone. Take it out and Google it and look it up. Never stop learning. That's going to be your biggest key to long-term success, is continuing to grow and learn as a respiratory therapist. Okay? The second thing you don't want to do as a new grad is get involved in the gossip mill. Trust me. Okay, trust me, you do not want to go out there and find yourself amongst the group of therapists that all they do whenever they're not out doing their therapy or stacking their 30 treatments is talking about other people. I promise you, those people will one day be talking about you. So you want to avoid those type of conversations. Now notice what I said. I didn't say avoid those people because they're still your teammates. But what you do want to do is get to know your teammates and interact with them in a positive manner. Biggest thing you can do, especially for moms out there, dads are cool with it too, but especially for the moms that you're going to go to work with, ask them about their kids. Oh my gosh, you'll have a best friend in 17 seconds. Hey, how are your kids? Tell me about your kids. What do they do? How old is your kiddo now? And watch them, they'll light up. And you will slowly start to learn positive aspects of your teammates' lives that then you can compliment, ask, and create a connection with. You may find out that somebody's like, yeah, hey, what do you do? What do you do when you get? What do you do in your spare time? Man, nothing really. I just take care of my kids, and every Wednesday night I go bowling in a bowling league. Really? I bowl too. Where do you bowl? I've been looking for a league to join, and now all of a sudden, through that positive talk, you made a connection, and you've made a friend, and you have the trust of a teammate that when you need help, they will be there. And they will soon learn that when they need help, you will be there. Okay? So avoid the gossip interactions and seek out the positive interactions that grow positive connections with your teammates. This also leads to a positive culture within your department. I've been in departments that have super negative cultures. I've been in departments with super positive cultures, and trust me, you want to be in this one. The positive culture has a sense of teamwork and just sense of happiness. Everybody's, for the most part, on a regular day is happy to be there and do their jobs. Versus the negative culture that is toxic. It's toxic to you as an individual. It's toxic to just about everybody. And what it does is it turns into a civil war between day shift and night shift and all this stuff that has no place in healthcare. So avoid gossiping. Do seek out personal connections through positive interactions. Okay? And then the last thing that, well, not the last thing, I got two more for you. Don't complain. Just don't do it. Okay, I know this sounds like I'm piggybacking on what I just said, but that was about gossiping about other people. What this one specifically is about is don't complain about the processes that you're working with when you go into a facility. Okay? Don't complain about the politics that are happening. At least not for the first year. You don't want to be the new grad that comes in and every time you have to do something, you say, this is stupid that we do it this way. You know, I did clinicals at this place and this is how they did it. That's so much better. Not to this place. It may be stupid. Okay? But you're not the person to complain about it or fix it at this stage of the game. You got to get some clout underneath you first. Okay? So don't complain. Now, after you've been there for a year, at least, do offer solutions to the bad processes at play. Let me give you an example. Place I used to work at, we used to have to go do, follow-up head CTs or whatever it was. It was typically CAT scan is what I'm going to be talking about here, okay? And the CAT scanner would call and say, hey, we're ready for you. And we would say, okay, we'd pack up and we head down. We'd get down there. Now I have a ventilated patient, a critically ill ventilated patient, on a compressed gas cylinder, okay? And you can do the formula if they're on a cannula and find out how long it's going to last, but you're running 50 PSI at 50%, maybe 60%, maybe they're on 100%. How long is that e-cylinder going to last, right? Not very long. So we would get down there and every single time we would have to wait outside the CAT scan room for them to finish another scan that they were doing. Now, from the CAT scan people's, from the radiology technologist's point of view, they're being efficient. While we wait on this one, let's get this one done. But what it did is create a situation where it put myself as the respiratory therapist who's in charge of this ventilator and this oxygen and the ventilation, oxygenation of this patient in a bind because I don't want to run out of oxygen. Hence, my ventilator will quit working because a lot of travel vents are pneumatically powered, right? So I need to conserve as much of this as possible. So instead of saying, you know what, guys, this is stupid that we have to wait outside of here writing up salt forms every time we had to wait, which is what I was instructed to do. Instead, I let it happen enough times, and instead of complaining about it, I went to my leadership team and I said, hey guys, I feel like this is a problem and this is a process that could be improved upon. So do offer solutions is what I'm getting at. Don't complain, but do offer solutions once you've received and once you've gained that clout as a valuable part of the team. So hey, what I would like to do, leadership team, is I would like to sit down with the radiology technologists, specifically the individuals that are running the CAT scan, and I would like to talk to them so they understand what is actually happening while we're waiting 5, 6, 10 minutes in the hallway outside the room. Because they don't know, and they shouldn't, because they're not respiratory therapists. Nobody understands compressed gas cylinders except for respiratory therapists, and understanding that you have a time limit, especially when you hook them up to a ventilator, right? They don't understand this stuff. So why should we expect them to automatically? We shouldn't. So complaining about it in a negative way doesn't do anything. They're thinking, well, they don't know how many scans I have to do today. Well, you're right, I don't. But you don't know how much oxygen I have in this tank. And that doesn't lead us to a solution. When we turn it into a patient safety issue, and both sides understand the picture of why this is a big deal, then the solution became, when you call for us to come down, the room is already open and it will remain open until we leave. And that's the solution that we came to, and that was the process that was implemented. And the next time it happened where we had to wait, we could fall back on this conversation that we held mutually between the respiratory therapy department and the radiology department that came to a common ground on this is a solution we can both live with. Now we both have to follow it. Why? Not because this is what the RT likes, and not because this is what you know the radiology technologists like or don't like, but because this is what's best for the patient. It's a patient safety issue. So do offer solutions, okay? One of the last things I'll tell you is do not leave a mess for your oncoming respiratory therapist. Don't leave a mess. If you have 4 ISs that were ordered up in the last hour of your shift and they were all still in surgery, and you're like, I'm not going to do that, they're still in surgery. I know what room they're going to, but they're still in surgery, I'm not going to do it. Or they're still sedated, they won't remember it, I'm not going to do it. I'm just going to wait for night shift, I'm just going to let night shift do it. That happens a lot, and it's perfectly okay. But what you should do is deliver an IS to that room, so at least they don't have to go get the IS. You could go ahead and calculate the patient's goal. You could go ahead and input the orders in the chart. See, that's not leaving a mess for night shift or for day shift. That's doing everything you can, considering the situation, to set the person after you up for success and not having to clean up a big giant mess in the first hour they get there. Another prime example is when you work the ICU. You have, 3, 4, 5, 6, 7 ventilators. Okay? The night shift is going to come in. Always change your waters on your ventilators before you leave your shift. If you walk in the room, and this is the question I get whenever I teach my students, this is, let's go change out the waters. This is the question I always get. But it's not empty. Okay, how much is in it? Well, I don't know, like this much? Okay, that's empty. Okay, if you look at the bag or the bottle hanging, and you have to ask yourself, is that enough? The answer is no. Take it off, replace it, hang a new bag. The last thing anybody wants to do when they come on to work a shift is go in there and clean up a mess. Have to go in and replace every water on every ventilator because they're all bone dry or because they're all less than 50% full. Because what's going to happen is a code blue is going to happen, and that's when that water is going to run out. Now, is it going to hurt if it takes 30 minutes to replace it? No. Is it best practice? Does it help the next person coming on? Absolutely. So just change it. You'll start to recognize people go, man, I love following this dude. My rooms are always clean. My circuits are always in good order. It's just not just like a sack of coat hangers. You know, your suction tubing is flowing nicely through everything. It's not all wrapped around the bed and the ventilator circuit 18 times. Like the rooms are in clean order. So all I have to do now is come in, learn my patients, and care for my patients instead of having to clean up your mess. Now, when you do this, and you do it consistently, the idea here is that they do it for you. You don't ask them to, but the reciprocation just happens because they start realizing how much they appreciate it. And they will, by nature, start taking care of you and other people on your shift without anybody having to ask. And before you know it, there'll be one or two people that just refuse to do it because they suck. And they'll be the ones that will not be working in the ICU for very much longer because they suck. They don't meet the culture of the therapists that are working in there and creating an environment, a positive culture that leads to a smooth transition when you come on for your shift. Okay? So those are my do's and don'ts for new grads. Now you asked about time management. I'm going to give you 3 tips for time management here real quick. First one is chart as you go. I know too many respiratory therapists. I've known them for too long. That, as a matter of fact, I used to be one. So I'm not gonna paint a picture like, oh, I've been great forever. No, I'm probably still not. But I don't make this mistake anymore. Okay? I've learned that the biggest part of time management in today's world of respiratory therapy is charting as you go. Because what happens in a lot of situations is you'll notice where people go do all their therapy, which means they stack 15 treatments. And then they come back, they take them all off, and they go back to the department and they sit down and chart them all. Or they wait and chart everything at the end of the day, which sets you up for disaster. So don't wait till the end of the day to chart. Chart as you go. There are computers in almost every room in most modern day facilities. So take advantage of it. Give your therapy, assess your patient, give your therapy, post-assessment, chart. Go to the next one. Okay, so chart as you go. It'll save you a lot of time. The second thing is stay on your floor. And you got to think about this. Some of these facilities these days are getting ginormous. Lots of different towers, and you're all coming out of one centralized department and going your own way. Let me just ask you this. If you go back to the department 4 to 5 times a day, in between rounds, or just for whatever it might be, you find yourself, I'm done, I'm going to go back to the department. Why? Because that's where my friends are. Okay? And then you get called back up for a stat ABG. Now you got to walk back up to the floor. And then you get done with the ABG and you go back to the department. And then it's time for your next rounds. So you walk back up to the floor. My point is if it takes you 10 minutes to walk from your floor to your department, okay, which is feasible in some of these facilities. Hell, some of them are even longer than that. Some of them are much shorter, I get it. But let's just say 10 minutes to walk from your floor, your assigned floor, to the department. And then it takes you 10 minutes to walk back. Then every time you go to the department, you've lost 20 minutes. If that happens 4 or 5 times throughout the day, then 4 times 20 is 80. 5 times 20 is 100. You've lost anywhere from 80 to 100 minutes, which is almost, it's an hour and a half to 2 hours worth of time that you have lost because you're spending it walking back to a place that has nothing for you. Nothing that's going to help you get your day done. Nothing. Stay on the floor. Evaluate your patients. Go talk to that COPD or that's about to be discharged and help them find ways to not be readmitted in 30 days. Connect with your nurses. I guarantee, I'll tell you this much, if you become a respiratory therapist that stays on your floor, the nurses will love you because if you talk to nurses, the common theme amongst nurses in regards to respiratory therapists is that we show up, do our job, and disappear. Where do we go? Well, sometimes we have another floor, but let's be real. A lot of times we're going back to the department to gossip. That's the truth. Okay, just being real with you guys. Okay, so stay on your floor. And then the third thing I have from a time management perspective is you're gonna have anywhere from 15 to 30, maybe 40 oxygen checks where the patient doesn't have any therapy. They're just having an oxygen check. You just need to check their oxygen, maybe wean it, maybe increase it depending on what they come in at. But you just need to stop in and check their oxygen. It's very quick. Hey, Mr. Jones, my name's Joe. I'm your respiratory therapist. I just want to check your oxygen real quick. Put the pulse ox on them, 96% on whatever, 2 liters. Turn it down to 1. Okay, have a great day. I'll stop back in and check on you later. Do that in between your rounds. That took literally what? An oxygen check takes literally less than 60 seconds. Okay, literally. You're going to go from room 401 to 405. Treatment in 401, treatment in 405. You finish this treatment, and then you're going to walk to room 405. In room 2, 3, and 4, you have oxygen checks. When you leave room 1, check bed 2. Then check bed 3. And then check bed 4. And then go to 5 and do the therapy. Now, it took you roughly 3 minutes in between those rooms to do those. Okay? But listen, you're done with them for the day. Unless something throws up a red flag, you've done. You've finished those 3 oxygen checks. You chart them. In the next room, when you get to bed 5, you chart them. 97% on room air, 94% on 2 liters, whatever it is, and you're done with them. Now, what I've seen is that a lot of people like to save their oxygen checks for later in the day. The problem with that is, and the reason they do this, they say, well, some of them may go home. Okay, so 4 oxygen checks go home. Does that break your day? No. But what you did is put undue stress on you at 4 or 5 o'clock in the afternoon now to do 30 oxygen checks and chart them. And then a code blue happens at 5:10. And you're in there until 6:10. And you still have 20 other oxygen checks that you still either need to perform or chart. Okay? So understand at the end of your day, a code blue can screw you up. And you want to have everything you can have done. My goal as a respiratory therapist when I worked on the floor areas and I worked in the same exact scenarios that I'm talking to you about, my goal was not to be done when my shift ended at 6:30. My goal was to be done with everything I had to do for the day by 5 o'clock. And I promise you, 75% of my time, I was done with my work at 5 o'clock. And I was on cruise control, just waiting for something to happen from 5 to 6:30. I was ready for a report at 6:30. I had time for cleanup that I talked about earlier. I would do that at 5 o'clock. Everything's clean, everything's straightened up, and my rest of my day is smooth sailing. Let a code blue happen. I don't care. I'm done with my shift. Nothing can mess my day up now. Okay? Now, what I sacrificed on the other side of that was talking time with my buddies, hour breakfasts, hour and a half lunches. I sacrificed all that to work efficiently, to providing care for my patients, and then having 5 to 6:30 free to just be available for whatever might come up that someone may need me. Okay? So, that's my tips, man. Just remember this. For everybody out there watching this, overachievers hate underachievers, and underachievers hate overachievers. You're not going to be liked no matter what you do. Somebody's not going to like you. So it's your choice if you want to be an overachiever or it's your choice if you want to be an underachiever. Okay? Say, Medicine Man, I hope this helps. Thanks for this. This is a great topic. I'm glad you asked me. If you got comments, questions, concerns, if you haven't subscribed, please do so now and check out my other videos. Best wishes.